This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Obesity is a major problem, according to the most recent study from the NIH. More than 1 in 20 adults are considered to have extreme obesity, and bariatric surgery is one of the most effective ways of helping people lose the weight and regain their life. Here to talk with us about bariatric weight loss surgery at Mercy Hospitals is Dr. Cyrus Moon, a bariatric surgeon at Dignity Health. Dr. Moon, thank you for your time. Let's start at the beginning. What is bariatric weight loss surgery?
So bariatric essentially means weight loss, and it's for people who are dealing with morbid obesity and any medical problems associated with the weight. And it's a surgery that essentially helps with weight loss. It used to be considered to only be for weight loss, but as science has discovered in the past decade or so, it also improves really the way the body basically metabolizes things as well. So that's why when we talk about bariatric surgery as bariatric surgeons, we also mention the metabolic effects as well.
So who is a good candidate then for this weight loss surgery?
So in 1991, the National Institute of Health actually created criteria that they thought would be good for people who are pursuing weight loss surgery, and that would be a body mass index of over 40. Body mass index is a measure of your weight over your height, and you can go to Google and anyone can find out or calculate their body mass index or their BMI. And that so criteria would be a BMI of over 40 or a BMI of over 35 with associated medical problems that are caused by weight. And for better or worse, this is still criteria we use today, even 20 years later, and that's what insurance usually uses as criteria to determine who qualifies for it.
And Dr. Moon, you mentioned people that have medical problems as well. What does this extreme weight, what are the problems that are caused by this? And obviously the weight is a huge issue, but what are some of the other physical problems that this extra weight causes?
So, there are a number of problems really from head to toe, but the most common problems have to do with the endocrine system and the cardiovascular system. So, diabetes is the major problem associated with weight. The extra weight causes insulin resistance. And then there's issues with high blood pressure, high cholesterol. The weight causes strain on the joints and can cause osteoarthritis. And then there are other problems associated with the weight, really ranging from reflux to infertility problems to cancer as well.
So bariatric surgery really can be a lifesaver for many people. So what are the different types of bariatric surgery options are there?
So there are a number that are being done in the world. In the United States, there's really 4 particular surgeries being done most commonly. The most commonly done surgery nowadays in the United States is the sleeve gastrectomy, followed by the Roux-en-Y gastric bypass that used to be the most common surgery, and it was previously considered the gold standard of bariatric surgery, but now the sleeve has surpassed that surgery. And then the gastric band is still being done occasionally, but it's really fallen out of favor because of its inconsistent results. And then the most powerful, quote-unquote, surgery for weight loss still being done right now is probably the duodenal switch, which causes the greatest amount of weight loss, but it does have side effects that keep it from really being done very commonly.
So with these main 4 options, how do you consult with potential candidates to help them choose or find out what is the best option for them?
So that involves really a face-to-face conversation about what they're dealing with and what kind of medical problems they're having trouble with. No two people are alike. So most commonly, as long as there aren't particular indications to not have one surgery or the other, most people end up getting a sleeve gastrectomy because it's pretty straightforward and the side effects are the lowest. But occasionally you'll meet someone who has severe medical problems that might, for instance, push them more towards having a duodenal switch, or if they have a particular problem with side effect of the sleeve, I might recommend a gastric bypass.
So, with advances in technology and techniques, usually this is what, an overnight stay, but then you have them up and around right away, generally. Isn't that right?
That is correct. These surgeries are done laparoscopically, meaning through small 5 to 10 millimeter incisions. And, no one ever feels the work that's actually being done on the actual gastrointestinal tract because that tissue does not have the same sensory nerves as like the skin. So when someone wakes up from this surgery, they may feel bloated from the CO2 that is used to kind of insufflate the belly for the laparoscopic surgery. But otherwise, they just feel the little small 5 millimeter incisions that were created and the soreness from that. And most people are, comfortable walking the same evening as surgery.
So, it sounds like there's not a lot of pain with this. So, what about long term success? Can you tell us about the efficacy of bariatric surgery?
So most people will lose anywhere from 50 to 100 pounds on average over the year. Now, long-term efficacy has a lot to do with how a patient's going to react to the surgery from a genetic standpoint or hormonal standpoint, as well as how they eat and exercise afterwards long-term. Now, these surgeries are not magic bullets that'll keep people skinny for the rest of their lives. It really is almost like a tool to help them lose the weight, but keeping it off long-term is really also a responsibility of the patient too. So, and most people, I would say, at least 50% of people keep their weight off long term. Out of the other half that have trouble, you usually see a kind of return to bad habits most of the time, like eating a lot of carbs or processed sugary foods and that kind of thing.
So, diet and exercise really important after the procedure as well. And can you tell us about the Mercy Bariatrics Program and what makes it so special and unique?
Well, the best part about it being in Bakersfield is that people in Bakersfield will have access to it. Bariatric surgery is not a one and done kind of surgery where you get it and then you never see your medical provider again. You have almost a lifelong relationship with your bariatric surgeon. Even if everything is going well, you kind of want to check in once a year to make sure everything is going well and your eating habits are well. You're not having any GI problems. So, our bariatric surgeons that go to Mercy, we're all local. So, it's very critical that you have access to your bariatric surgeon almost, at least within 24 hours if you have a major problem, and at least within a few days if the problem is minor. So, the beauty of having surgery in Bakersfield is you can see your surgeon whenever you need to when a problem arises.
So, it's almost like a partnership then. I mean, you are with that patient on that weight loss journey together, which is great. And Dr. Moon, if you could wrap it up for us, what else do we need to know about bariatric surgery?
So I would say, even among the medical community, there has been a pretty bad stigma against bariatric surgery for a while. I would say 10 to 20 years ago, bariatric surgery is actually much more dangerous than it is now. The technology we have for laparoscopic surgery has made bariatric surgery very safe, and the understanding that we have of how the surgery works really shows us really a myriad of benefits to having surgery, not just about the number you see on the scale. It's about really getting healthier overall. So I think anyone who has any hesitations really should just come in and talk to either the bariatric program people or talk to a bariatric surgeon about what kind of benefits they can get from bariatric surgery.
Great information, Dr. Moon, and thank you for your time and talking with us about bariatric surgery. For more information, please visit dignityhealth.org/Bakersfield/weight loss. That's dignityhealth.org/Bakersfield/weight loss. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.